Well, good afternoon. It's great to be back in beautiful Brampton, and I just love this community and the great people here. And I got to tell you, I say it all the time, but Carl and I, when we got married, we lived 5 years here in Brampton. It's just absolutely beautiful community, beautiful people. I'm here today with Health Minister Christine Elliott, as well as our local all-star Associate Minister Pratmeet Sarkaria, and Brampton Mayor Patrick Brown. And Mayor, you're doing an incredible job for the people of Brampton here. We're also joined by Dr. Naveed Mohammed and the outstanding team at Brampton Civic Hospital. Thank you to all the doctors, nurses, PSWs, paramedics, and all the incredible health staff right here at William Osler Health. You've been true heroes over the past few months. My friends, throughout this pandemic, we've been there for the people of Brampton. That's why we provided almost $35 million through the Safe Restart Agreement to support Brampton's municipal services and transit. That's why we're investing in the all-new Hurontario Light Rail Transit service for Brampton and Mississauga. And that's why we provided $64 million this year to Dr. Lawrence Lowe and his team at Peel Public Health to help hire 64 nurses for schools and support testing and contact tracing. And now, in the face of the second wave of COVID-19, we're fortifying the front lines of our healthcare system. It's why we're investing $2.8 billion in our COVID-19 Fall Preparedness Plan, the most comprehensive and robust plan in the entire country. It's a plan that will add nearly 1,500 hospital beds, including 139 critical care beds, to ensure we have the capacity to care for patients and fight this deadly virus. But our government believes there's still more to do. Today, I am incredibly proud to announce we are investing another $116 million to further increase our hospital capacity. We're adding an additional 766 beds in hospitals and other healthcare settings across the province. That's over 2,200 additional beds being added in communities, large and small, urban and rural. And Minister Elliott will announce in a moment that includes additional beds right here in Brampton. We have to be ready for anything. As we find ourselves heading from fall to winter, these beds, staffed by our top-notch health professionals, will deliver the quality care patients need and deserve. As we did during the first wave and during the summer, we're continuing to build surge capacity. We've allowed hospitals to construct temporary facilities on site to prepare for any scenario. We've allowed them to open beds in temporary facilities and communities, including hotels and recreation centers. I want to thank our municipal partners and local businesses, including the City of Brampton, for working with our hospitals to create this critical surge capacity. We will spare no expense to protect the health and safety of the people in Brampton and across Ontario. Because, my friends, I just love the great people here in Brampton. This is a community that is growing, and I can tell you it's growing fast. And as long as I'm Premier, my government will always be there for the people of Brampton, and that means more hospital capacity. It's an issue that's been ignored for far, far too long, but we're going to fix it. And today's announcement, it means more desperately needed hospital beds for this community. But we won't stop there. I know that we need to get a second phase of Peel Memorial Hospital built, and we will get it built. We are currently reviewing the best possible planning and design options with Osler to make sure we can build a world-class hospital that will serve this great community for generations to come. And my friends, as sure as I'm standing here, Peel Memorial Hospital, it will get built. And that's great news for the people here in Brampton. Before I pass it over to Minister Elliott, I'd like to point out this is Respiratory Therapy Week, and I want to thank, and a big thank you, to the 3,500 incredible respiratory therapists across our province. You've been on the front lines fighting this virus, helping connect COVID-19 patients in critical care to life-saving ventilators and respiratory treatments. These professionals are real heroes. On behalf of the people of Ontario, I thank you for everything you do. Thank you, and God bless the people of Ontario. Now I'll pass it to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. I would also like to thank the frontline staff and leadership team here at William Osler Health System for your heroic response to the COVID-19 pandemic. Throughout these unprecedented times, our doctors, nurses, and healthcare workers have shown us the depth of their compassion and their commitment to protecting and keeping us safe. I want to extend my deepest appreciation to all the staff, physicians, nurses, and volunteers at William Osler for your tireless efforts to deliver exceptional care to patients. Thank you from all of us. Protecting the health and well-being of all Ontarians is our government's #1 priority. That's why we are making the necessary investments to build more capacity to support our hospitals, reduce wait times, and improve access to care for patients and families in response to COVID-19. Today's investment builds on our fall preparedness plan by creating up to 766 more beds in hospital and alternate health facilities. This is in addition to the 139 critical care beds and up to 1,349 hospital beds we announced as part of our fall preparedness plan, bringing the total number of new beds to more than 2,250 across the province. And I'm very happy to advise that William Osler Health System will be receiving more than $19 million in funding for up to 87 beds. For patients and families in Brampton, that means up to 41 hospital beds right here at the Brampton Civic Hospital, and up to 46 hospital beds at Etobicoke General Hospital. The team here at William Osler serves one of the fastest growing regions in the country. Among the 3 sites, your emergency departments are among the busiest in the country, and we are thankful for your commitment to go above and beyond to provide innovative and compassionate care to meet the needs of your community. These beds will help ensure Brampton and Etobicoke have the resources needed to continue to respond to COVID-19. It means additional support for the continuation of more surgeries and procedures for patients in the coming months. And it means those who find themselves in the emergency room will know there's a bed available for them. Our government will continue to support the response to COVID-19 across the province, including right here in Peel Region. To date, we've provided Peel Public Health with approximately $64.4 million in funding for public health programs and services. This includes $4.3 million to hire 64 additional school-focused nurses, $100,000 to implement our public health case and contact management solution for COVID-19, and $1 million to support the implementation of the Ontario Seniors Dental Care Program. Our government will continue working with our partners to protect the health and well-being of Ontarians and ensure they can access the high-quality care they deserve. It is critically important, though, that everyone continue to do their part to protect each other by following public health measures and advice. That means wearing a face covering, frequent and thorough hand washing, maintaining physical distance from those outside your household, staying home when you're feeling ill, and limiting trips outside except for essential purposes. These simple, everyday actions are the best way we can protect our friends, family, and neighbors and stop the spread of COVID-19. By working together, and it will take all of us, we will put an end to COVID-19 in our province. And now I would like to pass things over to Dr. Mohammed, President and CEO of the William Osler Health System, to share a few words. Thank you.
Thank you. My name is Dr. Naveed Mohammed, and I'm President and CEO of William Osler Health System. It is a tremendous honor to welcome Premier Ford, Deputy Premier Elliott, Minister Sarkaria, and Mayor Patrick Brown to Brampton Civic Hospital today, and to receive news of this critical investment in Ontario hospitals. The addition of 87 beds across Osler's acute care hospitals, Brampton Civic and Etobicoke General, will have significant positive impact for our patients and the communities we serve. I want to personally thank the Premier and the Minister of Health for making this a priority and for getting it done. This announcement could not come at a more critical time. I also want to thank you both for working so tirelessly on behalf of the people of this province. It has been an incredibly challenging time, and you both have done so much. I also want to thank Minister Sarkaria and Mayor Brown for their tireless advocacy on our behalf. We thank you, and your community thanks you. Today's announcement is welcome news and comes as Osler is working diligently to ensure patients and the community continue to have timely access to the care they need, where and when they need it most. With one of the busiest emergency departments in Canada, the addition of 87 beds will help us prevent hallway medicine, especially as our community continues to grow and our patient numbers steadily increase over the winter flu season. We are adapting spaces at both Brampton Civic and Etobicoke General for these new beds to support improved patient flow across our sites. Given we had more COVID-19 patients in our hospitals than any other hospital corporation in the province during the first wave, this investment also helps us to ensure we can continue to provide high-quality, compassionate care for those who need us, especially as we continue to grapple with this pandemic in the coming months. Thank you once again for this investment in Osler and in Ontario hospitals. We are grateful for this support. Thank you.
I want to thank Premier Ford, Minister Elliott, and our hardworking MPPs, the Honourable Prabmeet Sarkaria and Amarjot Sandhu, for today's funding announcement. These 41 new patient beds will help alleviate hallway medicine at Brampton Civic Hospital. I want to thank in particular Dr. Naveed Mohammed and his team of doctors, nurses, and staff for their efforts at providing exceptional care while dealing with one of the busiest ER departments in Ontario and including a high volume of patients requiring medical treatments. As well, William Osler is leading the province in COVID testing, having administered over 230,000 tests at their assessment centres. It's so important to recognize our healthcare heroes during this pandemic. And I should note, Dr. Mohammed not only runs the hospital, but he continues to serve as a physician. And we feel very fortunate to have someone of his caliber leading the charge here at Brampton Civic. As you may know, Brampton City Council declared a healthcare emergency in January. Later that month, I had the opportunity to meet with the Premier directly to discuss our concerns about healthcare. He recognizes and understands the problem. It's certainly a problem he inherited and his government inherited. Previous governments of all stripes did not adequately fund the high volume of patients needing care in our community. Numerous challenges contribute to Brampton's hallway medicine pressures: rapid population growth, aging demographics, significant chronic disease, high emergency department volumes, and ongoing funding inequities in comparison to other regions of our province. In 2018, the Central West LHIN had 0.96 beds per 1,000 people, while the provincial average was 2.19 beds. So when we talk about the need for beds, you can understand why. Brampton is the fastest growing of Canada's large cities, projected to grow from its current population of nearly 650,000 to over 900,000. Quality care is threatened by the funding gap in our healthcare providers. These challenges that our facilities face are significant when you look at the volume compared to the rest of Ontario. I want residents to know that in August, our council members had a very good discussion with Minister Elliott. She heard about our concerns, she sat down, she heard us out about our need for immediate funding for new medicine surge beds at William Osler Health System to support safe patient care in light of COVID-19 and to ensure capacity for the upcoming winter flu season. We also discussed the need for her ministry to approve Phase 2 redevelopment of Peel Memorial Centre for Integrated Health and Wellness. And let me say, it was more than music to my ears to hear the Premier say once again that he is committed to that project. Actually, when I heard him say, we're going to get that hospital built, we're going to get shovels in the ground, a huge smile came to myself and frankly all the residents of Brampton, because this is this is so important to our community, and I know this is the second time that he's highlighted publicly that he's behind this and he wants to get it done. I also want to note that today's announcement is quite significant and a positive step. I look forward to working together with the Premier and Dr. Mohammed to address healthcare needs in our community. These additional beds are going to make a big difference, and the fact they're also adding to ICU at a time when COVID's on all our minds is a huge step forward for our community, a very positive step. So thank you, Premier Ford. Thank you, Minister Sarkaria and Minister Elliott.
Thank you very much, Mayor Brown, Dr. Mohammed, Minister Elliott, and a very special thank you to Premier Doug Ford for supporting the people of Brampton throughout this pandemic and for his commitment to this region after numerous governments have failed to address the high needs of one of the fastest growing regions in all of Canada. You've been a champion for hardworking families and the thousands of job creators who have sacrificed so much to bring opportunity to Ontario. And throughout this pandemic, you've been clear that protecting people's health will always come first. That's why I'm so encouraged by today's announcement for Brampton. COVID-19 has presented challenges unlike anything our community has ever faced. But our government's investment in Brampton through the Fall Preparedness Plan and our commitment to Phase 2 will ensure that we have the tools to meet these challenges. As the Premier announced, today's investments will further expand Brampton's capacity with additional hospital and critical care beds. And it builds on a number of additional ways we're increasing capacity across our healthcare system, including investing to hire more school-focused nurses and support of Brampton's kids and their parents. So I'd like to thank Premier Ford, Minister Elliott, and William Osler CEO, Dr. Naveed Hamid, for their work, partnership that made today possible, and for your tireless commitment to improving the health outcomes of all Bramptonians. Thank you very much.
Just 1 second before we take the questions, Christine. I got to tell you, folks, when I came in downstairs and through the loading docks there, I never give these people a shout out, but they are critical to the operations of any single hospital. That's the kitchen staff, the electricians, the engineers, the people that keep the engine going. So, you know, to all the people that are out there putting the meals together for our patients here in the hospitals, I thank you. That's the backbone of every single hospital. So you're all champions. Thank you.
We'll go to the phone line for question, please. One question and one follow-up.
Your first question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. My first question is actually for the Health Minister, if you don't
Sure.
mind.
Yep.
Minister, we wanted to ask you about hospital capacity. In Toronto and Peel, where 60% of the new cases are being reported, the Health Network says that some hospitals in these regions are at 100% capacity. So is that the case, and do you know which hospitals in these regions are running at 100% capacity?
Yes, we receive daily reports on the status of hospitals across the province, and it's very important for us to make sure that hospitals do have additional capacity for our COVID-19 patients, for flu patients, and also for the people that need the surgeries and procedures that we had to postpone during the first wave. That's why today's announcement is so important, that we're putting 2,250 new beds into the system to allow those that have the greatest capacity challenges to be able to expand. But we're also putting $450 million into expanding home and community care, because there are some people who are remaining in hospital that could be cared for at home, but they will need amplified home and community care responses, so we're doing that. And we've also opened up a number of reactivation care centers, which will help people who may be in hospital as alternate level of care patients waiting for long-term care, but they can go to these centers which are more appropriate for them, because they can receive physical rehabilitation and social rehabilitation, with the goal that some of them may actually be able to return home. Others will continue to need to wait for long-term care, or there may be a retirement home placement perhaps that's going to be suitable for them. So in addition to creating the bed capacity to help those hospitals that are at capacity, we're also amplifying our resources in a number of other areas as well.
Follow-up?
Thank you. And my follow-up is for the Premier. Premier, we wanted to ask you about Suncor Energy and the fact that it's relocating some positions in Mississauga and Oakville to Calgary by next year. And Ontario could potentially lose hundreds of jobs to Alberta. So how do you feel about this? And did you have a chance to talk with the heads of Suncor to try and persuade them to reconsider?
I have not had an opportunity to talk to the people at Suncor, but I will speak to them. The good news is we're seeing a lot of jobs coming from Alberta and other regions around the world into Ontario. And Roche is a perfect example. We competed against 13 countries around the world, and they chose Ontario, they chose Mississauga to open up and create 500 new great paying jobs and expand their facilities here. So I'll make a point of reaching out to Suncor and trying to convince them, expand your operations here, opposed to anywhere else in the world. It's the best place anywhere in the world to work and live and invest, right here in Ontario.
Next question.
Your next question comes from Isaac Cowan with The Pointer. Please go ahead.
Isaac, how
Hi,
you doing?
Premier. I want to start with reminding you about a couple of the cases over the last few days in Peel. On Sunday, we saw 289 new cases of COVID-19, and on Monday, we saw 215. We found out last week that the test positivity rate in Brampton is up at 8.1%, something which suggests that enough testing is just not taking place in the city. Can you explain to me why Brampton has only operated with one full test facility for the whole pandemic, and if you're going to do anything to change that?
Well, I'll pass it over to the minister, but I just want to remind everyone we're leading the entire country, bar none, everything combined. We're doing more tests than anyone in the country. We're almost to 5 million tests the last 4 weeks. We've produced almost a million tests, but I'll pass it over to the minister.
Well, as the Premier indicated, we have increased our test capacity to the point where we've tested almost 5 million Ontarians, a third of the population. But there are some areas where we are amplifying our testing abilities with, in addition to the assessment centres that we have open, we've also opened up pharmacies for people who are asymptomatic but who need to be tested in order to go back to work in a long-term care home, for example. Those are examples of additional facilities that are being opened. But we also know that since we have moved into testing by appointment only, there are some people that are not coming in for testing, and so we're needing to go to them. So we've identified some neighborhoods. They have been identified in Toronto and some in Peel region as well, where we need to go with pop-up test centers or mobile test centers to encourage people to come out and be tested. So while we have permanent sites, we also have mobile sites as well, because we don't want anybody who needs to be tested to go without a test. And so in situations where people are not feeling comfortable coming to us, we will go to where they are.
Follow-up?
You referenced pharmacies there, Minister Elliott, and we've done the math on the pharmacies available in Brampton. If they were to operate at full capacity all day, they'd be able to do just about 300 tests between them. So it doesn't really address the major testing issue that is a problem in Brampton. I know you have these numbers for the province as a whole, but I'm asking really for the people of Brampton, who we've heard they need a second test centre in the city to serve them. Will you commit today to setting up a second official full drive-through facility in Brampton?
Well, I can certainly advise you that we will look into what's happening in Brampton. If there aren't enough test facilities, we are in regular contact with Dr. Lowe, and we will certainly, if there's a particular area where there needs to be another assessment center, drive-through center, we will certainly do that, because as I indicated earlier, if someone needs to be tested, we want them to be able to go to a location that's close to them and then receive the results in a timely manner. But in addition to that, we're also looking at many of the new tests that are coming on the market as well, point of care tests and so on. There are some that have to be approved yet by Health Canada, but some of the Abbott tests that are coming on the market, we will be receiving the first shipment, and we're deciding where to put them, because though they might not be, some of them, completely as accurate as the nasopharyngeal testing that we're doing, they're still very useful in other locations. So I can certainly commit to you that we will look at the centers in Brampton, and if more are needed, we will certainly set them up.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Hi. First question's for the Premier. There's as reported in the Toronto Star today, your government has imposed ministerial zoning orders that have, effectively overruled the process within Toronto to allow for zoning of some developments in the Dawnlands. Wondering why your government felt the need to do this, and how you justify basically stepping over a municipality in an issue that's that ought to be, I guess, left up to municipalities.
Yeah, well, thanks for the question, Mike. It's actual provincial lands. It's not the city lands. But in saying that, we should always be consulting. I had a great conversation with Mayor Tory. I talked to him multiple times a week, and as I joke around, I probably talk to Mayor Tory more than I talk to my own wife. So we're always in communications, and the good news about this story, and there is good news, out of that site, we're going to create 1,000 affordable housing units that we're in desperate need. And sometimes you have to put an MZO rather than wait 3 years to go through all the process. We're in desperate need of affordable housing across this province. There's no place that we need it more than in Toronto. And I'm glad that we're going to have 1,000 affordable housing units available to the people of Toronto.
Follow up.
And a question on another topic, also Toronto related. CBC News published an investigation today into disciplinary decisions within the Toronto Police Force over the last 10 years. And, even though there were officers in this that were disciplined for criminal convictions, assault, impaired driving, nearly all of those officers kept their jobs after the disciplinary process. So there's some concern that it's the Police Services Act, the provincial legislation, that is not giving the police force enough leeway to discipline these officers after they've been convicted. Would you support changes to that act?
Well, I would.
Can you explain, why you wouldn't?
Well, Mike, first of all, I'd have to look into exactly what happened, and I think they have a great board over there. I know Mayor Tory sits on the police board, and if there's recommendations from the police board and it involves the province, we're always open to looking at it and working, again, collaboratively with the city and the police board, and along with the police association as well.
Next question.
Your next question comes from Graham Richardson with CTV Ottawa. Please go ahead.
Hi, Graham.
Hi, Premier. I have a general question about different approaches between you and your friend Jason Kenney, and I'm not trying to. The pandemic's a complicated thing. Do you have any thoughts on what Alberta is doing versus what Ontario is doing? In that Alberta, of course, is seeing a surge, but their businesses are still open, and it's a different approach. Have you talked to him about that? What do you say about that?
Well, first of all, I think the world of Jason Kenney is doing a great job out in Alberta. We're taking a little more cautious approach. We're probably 4 times the size of Alberta, a very large population here, a little different than Alberta. But I always like looking around the world and taking the best ideas from everywhere, no matter if it's in Alberta or other regions in the world, and we have to learn what works and what doesn't work. What I do like out in Alberta, and I talked to the Deputy Prime Minister on Sunday about this, is Calgary Airport. I'm a strong believer of, I've been saying it right from the get-go, that if people want to reduce the weight that they have to isolate for 14 days, let's see what happens in Calgary and Alberta when they get tested, and if it works, let's adopt it here in Toronto.
Follow up.
And more specifically here in Ontario, where I am in Ottawa and where you are in Brampton and areas around Toronto, it's happening again in long-term care. The deaths are going up again. There are outbreaks all over the place. And again, I appreciate this is a complicated issue with an aging system. Sometimes you still have 4 people to a room. But this terrible thing does seem unique to Quebec and Ontario in terms of the numbers and how hard nursing homes and retirement homes are being hit by COVID. Is it too late to do anything now? Like, what happened here between first and second wave, if anything?
Well, it's never too late, but the best person to answer that is the Minister of Health. Thank you.
Well, one of the reasons why Ottawa's put into a modified stage 2 situation was because of the increase in the number of cases. There's a number of other factors that come into it, including the fact that Dr. Etches was willing to have Ottawa enter into that stage. But one of the concerns is that there's a number of links to some areas that are causing concern, but there's no real huge epidemiological link, so no known cause, which means that we have to follow more stringent public health measures. That's one of the reasons why there has been a movement of COVID into some of the long-term care homes, and why it's really important that we continue to follow these measures so that we can stop this community transmission and therefore stop the spread in our long-term care homes, retirement homes, and other places where we have really vulnerable citizens. So the good news, and if there is any in all of this, is that the case numbers in Ottawa are starting to go down. The measures are working, but we still have work to do so that we can protect these very vulnerable residents.
Last question.
Your final question comes from Travis Danraj with Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. I've got a question to you about food delivery. I know your nephew, Councillor Michael Ford, has a proposal before Toronto City Council on food delivery service commission caps. You've talked about this before. How does the province plan to support this type of move province-wide?
Well, we have to protect the restaurant owners that are struggling out there right now, and what's happening, not all, but some food delivery companies are charging 30% to the restaurants, and these poor folks are just struggling, holding on by their fingernails, and I just don't think it's right. You know, like some of these companies are making a fortune right now, but like, give back, help out, support the restaurants. Don't be, gouging them at 30%. And then on top of that, Travis, there's a delivery charge, service charge. Like, man, step up to the plate, guys. You're making a fortune. Give back. Cut your fees in half. You'll survive. But these restaurants are struggling, so let's support them. And we'll be talking to the mayor about this later. And if they need our support, we'll be there to support them. But I always like asking the companies first, step up and volunteer some support.
Follow up?
Yeah, I want to ask you again about this photo with Sam Oosterhoff, because it continues to get a lot of attention from people online. Betty's Restaurant, this is where the gathering happened, put out a statement on Facebook saying this group was reminded several times that they were required to wear masks when not seated at their table. Unfortunately, they chose not to follow posted rules about wearing masks and distancing. Now, you have called folks who blatantly skirt the rules before yahoos. You said that you were going to be on them like an 800-pound gorilla. So considering this information from the restaurant, why is MPP Oosterhoff, who was clearly reminded of the rules, not a yahoo, why aren't you on him like an 800-pound gorilla, and why does there seem to be no repercussions for this member of your caucus?
Well, again, I encourage everyone. It's absolutely critical. You got to wear face coverings. It's very simple. When you go into restaurants, you have to wear them. MPP Oosterhoff came out. He apologized. He said it's not going to happen again, and I accept that. There was a mistake made. We all make mistakes. I understand that, and I take him for his word. He's a great MPP, and I support Sam like I support everyone. And every Travis, everyone makes mistakes. He apologized. He's not going to do it again. So, he understands, and I'm sure he'll pass it on to the rest of the folks that were there as well. But please, if you're in an indoor setting, please just wear a face covering.
Thank you, everyone.
Thank you, everyone. Great news for Brampton. Thank you.